In our morning rounds, keeping your weight from going up, up, and away, the FDA is reviewing a new type of gastric balloon that starts as a pill. In clinical trials, patients who were 40 to 60 pounds overweight lost an average of nearly 7% of their body weight in 6 months. But the treatment is a little more complicated. Dr. Christine Ren-Fielding is chief of bariatric surgery at NYU Langone Medical Center. She treats patients with one of the 2 existing balloon devices and joins us at the table with some props. So we all know that there's no magical pill. We all wish there was, but we know it isn't. But this one has a potential, you said, to make a big difference. How does it work?
Well, Gail, the concept is the same. What we have right now in the United States that's available is a balloon filled with water that takes up space inside of your stomach.
And it's surgically implanted.
This is endoscopically implanted. No surgery, no cutting, but you do need endoscopy to place this and inflate the balloon inside of your stomach. And it stays in there for 6 months in order to take up space so that you don't have food taking up space. You then have to take it out with another endoscopy. But what's coming out in new studies and new technology is that there are balloons that are smaller than this, but are filled with air, which you can just swallow in the form of a capsule. So you don't need endoscopy in order to insert the balloon. You take a capsule, it's about the size of a quarter, it's connected to a thin catheter, you swallow it, and when it goes down into your stomach, you hook it up to a gas tank, it inflates, and then you disconnect the catheter, and you have a little balloon taking up space in your stomach. And you can swallow up to 3 of these balloons over the course of several months.
How do you get them out?
Well, that's when you do need endoscopy. And
my mind is going many places here. Okay.
But it's no surgery, so it's very good for people who are frightened of surgery or don't have that much weight to lose.
So, but this is only approved in Europe and Mexico, right? Do you think it'll be approved soon here in the U.S.?
Yes, I believe it will be approved sometime next year, hopefully in the first quarter.
Why are we behind Europe, say, in approving things like this?
Well, I think that the American government has much higher standards. There's much more criticism of the public and wanting to make sure that we have the safest items.
How does this compare to bariatric surgery, the results?
Well, the balloon typically will give you anywhere between 20 and 40 pounds. And it's really meant for individuals who have 20 to 40 pounds to lose, not the 100 or 200 pound overweight person. Bariatric surgery is really for people who have been severely obese for many, many years, who need to lose 100, 200 pounds, and that's a lifelong.
So do you like this pill? Do you like the idea of the pill?
I really like the idea of a pill because you're always trying to improve your medical treatment, and you want it to be less invasive.
Yeah. Well, Dr. Ren-Fielding, it's really important, saving people's lives and improving their quality of lives, what you're doing and these new advances. Thank you.
Thank you very much.
What are airlines doing to help the TSA with those massive security lines? We're going to ask the JetBlue CEO, Robin Hayes. Look, he's here in Studio 57. Gail loves JetBlue to LA.
I really do.
Yeah, we're also
going to TVs.
Yeah,
I love it.
We'll also look at his company's major expansion ahead here on CBS This Morning.
What do they call that one?
CBS Morning Round, sponsored by Coppertone Sunscreen.